In the ancient Roman world, where medicine often blurred the line between ritual and science, some of the strangest treatments came from the sea. Among them was the use of electric rays, known as torpedo fish for therapy. These flat, disc-shaped creatures, related to modern rays and sharks, possess powerful electric organs capable of delivering shocks as high as 600 volts. Today, we recognize this as a natural defense mechanism. But to Roman physicians, it was a medical tool. Writers like Scribonius. Largus, a physician in the 1st century AD, described in detail how patients suffering from gout, or persistent headaches, were instructed to stand on a live electric ray or place it against the part of the body in pain. The result was an immediate electric jolt, numbing the limb and sometimes reducing inflammation. Scribonius wrote that those who endured the discomfort long enough often found relief. In his view, nature had provided a cure hidden in the sea. The practice was one of the earliest forms of electrotherapy, using electricity for healing, though. The Romans had no understanding of electricity as we define it today. To them, the torpedo fish was simply a living source of mysterious energy, capable of stunning prey and soothing pain. Some accounts even suggest the treatment was recommended for chronic headaches, where patients were instructed to hold the fish against their head until the pain subsided or numbness set in. Of course, the treatment was not without risks. The shock could be painful, unpredictable, and potentially dangerous for frail patients. Yet in a world where remedies ranged from bloodletting to poisonous concoctions, using a fish's natural discharge seemed no stranger than any other medical experiment. For some, the relief was real enough to make the method endure. This strange therapy highlights both the ingenuity and desperation of ancient medicine. With no microscopes, no germ theory, and no true understanding of electricity, Roman physicians nevertheless recognized the anesthetic effect of the torpedo shock. Their crude trials anticipated later discoveries in neurology, where controlled electrical stimulation would become a legitimate medical treatment for pain, seizures, and even depression. In a bizarre way, the torpedo ray was a forerunner of modern devices like TENS units or deep brain stimulators. The story of electric eel therapy, though in Rome it was the ray. Not the eel also shows how ancient healers drew from nature with little hesitation. Every plant, mineral, and animal was a potential cure. That willingness to experiment, however odd, laid the groundwork for later science. Even if standing on a fish to numb your gout seems absurd today, it was a genuine attempt to ease suffering with the tools available. The next time you see electrodes used in a physical therapy clinic, remember that nearly 2,000 years ago, a Roman patient might have found themselves standing on a live electric ray, gritting their teeth as the shock pulsed through their body in the name of healing.